Pluerisy. Pluerisy, otherwise known as pleuritis. It is the inflammation of pleura. We knew that there is two layers for the pleura, that is visceral layer and the parietal layer. When there is inflammation occurs in this layer, that leads to inflammatory response, that is known as pleurisy or pleuritis. In this picture, you can see that normal pleura, there will be parietal pleura and the visceral pleura, and there is adequate pleural space. But in case of pleurisy or pleuritis, there will be inflamed pleura, so that's why pleural space is decreased. And here there will be edematous, the layers, parietal and visceral layers are edematous, and there is inflammatory response. Now we can see what is the etiology of pleurisy. The etiology of pleurisy include toxins. Toxins, example asbestos, drug-induced toxins. Then cardiac etiology include pulmonary embolism, myocardial infarction, pericarditis. Pericarditis means inflammation of the pericardium. Cardiac issues, because there will be these are the adjacent organs. So when there is cardiac problems, usually the pulmonary problems also will be occurs. Then infectious, that mainly the bacteria, virus, fungal, parasitic, all these infections may cause pleurisy. Then respiratory problems, respiratory etiologies like pneumonia, tuberculosis pleuritis, viral pleurisy, pneumothorax. Pneumothorax means air in the thorax. So the respiratory problems, that also a predisposing factor for the pleurisy. Then autoimmune disorders like systemic lupus erythematosus, then rheumatoid arthritis, Sjogren's syndrome, then granulomatosis, vaginous granulomatosis. So the autoimmune disorders, in autoimmune disorders, here our body cells acts against our immunity, right? So that's why the autoimmune disorders cause problems to the human body. Autoimmune means the immunity will digest ourselves, or immunity will problematic to ourselves. Okay. So autoimmune disorders, example systemic lupus erythematosus, rheumatoid arthritis, Sjogren's syndrome, then vaginous granulomatosis. Then gastrointestinal problems include inflammatory bowel diseases, then spontaneous bacterial peritonitis. The hematological problems include malignancy, the cancer, okay, malignancy or the cancer, then sickle cell disease. Then iatrogenic, that is thoracentesis, chest tube insertion, thoracotomy, and pleurodesis. Iatrogenic means physician induced. So, or physician induced, or the or due to any procedures that we are undergoing that may leads to pleurisy. That is the thoracentesis, chest tube insertion, thoracotomy, or pleurodesis. So the etiology, you just understand the headings: toxins, cardiac, infectious, respiratory, autoimmune disorders, gastrointestinal, hematological, iatrogenic. So when you are remembering the headings, you can write the etiological factors in the etiology in underlying the pleurisy. Okay. Regarding pathophysiology, due to etiological factors, there will be infection or inflammatory response. That's why pleura are affected and it becomes edematous and congested. So in these edematous and congested, there will not be adequate pleural space when it comes together, or here there will be fibrous exudate. the presence of fibrous exudate also will be come due to inflammatory response. So when there is the pleural layers is edematous, what happens is it will rub together. Okay, so when these layers rub together, that cause very intensive pain. So that is the feature of pleurisy. So in pathophysiology is very simple. Due to etiological factors, there will be inflammatory response. Due to this inflammatory response, the pleura become edematous and congested. So what happens? It become rubbed together and cause a knife-like pain. Okay, when we are piercing with knife, that like pain will be occurs for this patient. So that is regarding the pathophysiology of pleurisy. So due to the inflammatory response, there will be exudative pleurisy or the dry pleurisy also will be come. Next one, types of pleurisy. Types of pleurisy, I already told that it is dry pleurisy and wet pleurisy. So in dry pleurisy is the common pleurisy that occurs normally. Here the inflamed pleura and there will be pleural friction rub, and there will be the pleural layers will rub together. That's why intensification of pain will be very high in case of dry pleurisy. Dry pleurisy is common. Here there will not be exudate. Instead of that, due to inflammatory response, the pleural layers will be edematous and congested. So that's why it will be rubbed together and cause excruciating pain. Next one, wet pleurisy. Wet pleurisy means fluid oozes from the inflammation. That's why there will be effusion or exudate formation that will compress the lung. Okay, so here in wet pleurisy, what happens? There will be, due to inflammatory response, there will be exudate formation or the fluid accumulation in the layers, in between the layers of pleura. That is known as the wet pleurisy, and that may cause compression of the lung. So here the person will have sudden difficulty in breathing, and severe pain also will be present. And both pleurisy may result from respiratory infection or complications like pneumonia, viral disease, and TB, also a etiology for the pleurisy. Next one, symptoms of pleurisy. Symptoms of pleurisy include pain that can be sharp and stabbing pain in a particular area of chest, then pain in the shoulders, cough that can be dry or productive if there is infection, breathing can be shallow, then fever and chills in case of infections. So the pleurisy signs and symptoms include pain. The important feature of pleurisy is the pain, and this pain will be sharp and stabbing pain, and which area is affected, that particular area the person will have severe pain. Then the radiating pain may occurs in the shoulders, then cough that may occurs, it may be dry or productive, then sometimes there will be pleural effusion, then intercostal tenderness also present with pleurisy, then pleural friction rub, that is very important sign that can hear. Okay, so pleural friction rub, then fever and chills in case of infections, and breathing problems also will be present. So these all are the signs and symptoms of pleurisy. Next one, diagnosis of pleurisy. It include the history and physical examination and clinical manifestations. So along with the symptoms, we have to take chest x-ray, CT scan or USG. Along with there will be blood test, thoracoscopy or thoracentesis in order to detect the pleural fluid examination. Then MRI, CT scan also can be done. So the main diagnostic measures of pleurisy include the chest x-ray. And thoracosynthesis is the thoracosynthesis that will help to detect the microorganism present in the pleural fluid. So that is the diagnostic measures. Treatment of pleurisy include treatment of underlying condition, symptomatic treatment for dry pleurisy, especially the analgesics and anti-inflammatory drugs. So usually ibuprofen, endomethacin that can be given. Then symptomatic treatment of exudative pleurisy include anti-inflammatory drugs, diuretic agents, then evacuation of effusion by means of puncture or thoracosynthesis. So treatment mainly analgesics, indomethacin can be given. Then intercostal nerve block can be done in order to reduce the pain. Then corticosteroids therapy, especially the hydrocortisone we will give. Then in diuretic therapy usually Lasix will be given. Then treatment of underlying causes means mainly the antibiotics. Okay, then surgical management is the thoracosynthesis. And in case of cough, we have to give codeine in order to suppress the cough, especially in dry cough, because while coughing, the patient may have severe pain. So, in order to reduce this pain, the cough suppressants can be used. Then, the main surgical management is thoracosynthesis. Okay, the exudative fluid can be removed by thoracosynthesis. Next one, complications of pleurisy. Especially in case of exudative pleurisy, the main complication is pleural effusion. Then atelectasis, it may affect the lung and that may lead to collapse of lung. Then emphysema or empyema also can be occurs. Then lung fibrosis can be occur. Then hemothorax, blood in the thorax. So this is the main complication: pleural effusion, atelectasis, emphysema or empyema can be occur. Then lung fibrosis and hemothorax.